Good morning. I want to thank you for joining us for the 2024 NFID Annual News Conference, Preventing Respiratory Disease this fall and winter. I'm Dr. Bob Hopkins, Medical Director for the National Foundation for Infectious Diseases, or NFID. For more than 50 years, NFID has been educating and engaging the public, communities, and healthcare professionals about infectious diseases across the lifespan. As part of our mission, we have been hosting this important news conference for more than 25 years. Each year, this news conference serves as a kickoff for the upcoming respiratory season, where we discuss the latest information and reinforce the importance of disease prevention. As was the case during last season, we're dealing with multiple respiratory diseases circulating now, including influenza or flu, COVID-19, respiratory syncytial virus or RSV, and pneumococcal disease. These diseases can all cause serious, potentially life-threatening complications, hospitalizations, and death, even in healthy children and adults. The good news is that there are safe and effective vaccines available to help protect against all four of these diseases. Everyone 6 months of age and older should get an updated COVID-19 vaccine and an influenza vaccine, and this includes pregnant women in our population. Older adults, persons with chronic health conditions, pregnant women, and parents of young children should talk to a trusted healthcare professional about how to protect against RSV and pneumococcal disease. Despite the availability of safe and effective vaccines, overall immunization rates continue to fall short of public health goals. Before we begin today's panel discussion, I'd like to share some highlights from the new NFID National Survey on U.S. adult attitudes and behaviors about respiratory diseases. Overall, less than 1 in 5 U.S. adults are concerned about themselves or someone in their family getting a respiratory infection this fall and winter. 2 out of 3 U.S. adults, or 67%, agree that annual flu vaccination is an important and effective way of preventing flu-related hospitalization and death. However, nearly half, 45%, say they don't plan to or are unsure they'll get vaccinated against flu this season, and only 17% are concerned about flu. Only 20% are concerned about COVID-19, and a staggering 61% said they don't plan to or are unsure if they'll get a COVID-19 vaccine this season. And among those recommended to get an RSV vaccine, nearly half, or 44%, said they don't plan to or are unsure if they're going to get an RSV vaccine. In fact, the NFID survey found that nearly half, or 49% of adults diagnosed with flu over the last 2 years, plan to get a flu shot, showing that firsthand experience can motivate people to get to get vaccinated. As healthcare professionals, we also need to tap into factors that motivate people to get vaccinated. Getting vaccinated helps protect not only yourself, but your loved ones and your communities as well. Severe infections are most likely to occur among the unvaccinated, older adults, and those who are immune compromised or have chronic health conditions. However, no one is without risk, even including the young and healthy. And in cases where vaccination doesn't prevent infection completely, it can reduce the duration and severity of illness and help prevent serious complications, including hospitalization and death. It's natural to have questions about your health. I urge everyone to talk with a healthcare professional if they do have questions about specific vaccines or the safety and effectiveness of vaccines in general. Our goal is to ensure that everyone is protected. It takes a village and an entire immunization neighborhood, including doctors, nurses, pharmacists, and public health, to speak to our communities and to vaccinate them all effectively. Now, I'm pleased to introduce the experts with us here today, including Dr. Mandy Cohen, Director of the Centers for Disease Control and Prevention, or CDC, Dr. Demetre Daskalakis, Director of the National Center for Immunization and Respiratory Diseases at CDC, Dr. Flor Muñoz, NFID Director and Associate Professor of Pediatrics and Infectious Diseases at Baylor College of Medicine, and Dr. Reed Tuckson, co-founder of the Black Coalition Against COVID and chair of the board of the Coalition for Trust in Health and Science. Following our discussion, we'll field questions from the media, but all questions will be held until the end of the panel discussion. I'd now like to ask each of our panelists to briefly introduce themselves now. Dr. Cohen, please begin.
Terrific. Well, first, Bob, thank you. Good morning. Mandy Cohen, Director of the CDC. Wonderful to be here. I am thrilled to be kicking off our efforts to make sure folks know that the single most effective thing that they can do to protect themselves as we get into fall and winter is to get vaccinated. We have an updated COVID vaccine, an updated flu vaccine, an RSV vaccine. All of those can help protect ourselves, our families, our communities. I'm excited to be here with the Walmart team who's going to give me my vaccine this morning. So I hope folks are making a plan now to get their vaccines. Right now is the right time to get your vaccine to protect you as we get into the fall and winter. I look forward to the conversation. Thanks so much.
Dr. Muñoz.
Thank you. Good morning, everyone. My name is Flor Muñoz. I am a pediatrician. I'm an infectious diseases specialist, but I actually have worked throughout my career on pregnant women vaccination and infant vaccination. And I firmly believe that we do have a very important role as healthcare providers. I'm in academics, but also take care of patients in recommending vaccines for our patients, especially educating everyone about our role in terms of infectious disease protection. So I'm very excited to be here and representing these populations. Thank you.
Dr. Tuckson.
My name is Tuckson, and I come to this work from the perspective of having been the Commissioner of Public Health in this great city during the height of the AIDS epidemic, which really taught me how important it is that we engage with communities. And so we created the Black Coalition Against COVID, which united all of our Black medical schools, the Black physician and nursing associations to fight this. And also I am the convener of the Coalition for Trust in Health and Science. Given that the issues of distrust and misinformation are so important, we were able for the first time in history to unite the entire health ecosystem end to end, 90 organizations dedicated to helping the American people have the science and evidence upon which to make personally appropriate health choices for themselves, their families, and the communities in which they live.
And Dr. Daskalakis.
I'm Demetre Daskalakis, and I am the director for the National Center for Immunization and Respiratory Diseases. So my message is going to be really simple. I'm also an infectious disease doctor and continue to see patients living with HIV. But my very simple message is, like Dr. Cohen said, now is the time. So this is the time that we can make sure that folks are protected against COVID, flu, and RSV. No time like the present to get those vaccines. They work, but they don't work if they're on the shelf. So whether you're a provider who is able to give vaccines or someone who's like, should I be getting my vaccine now? The time is now.
Great. Thank you all. We'll now begin by discussing some of the latest data and trends and what they mean for the upcoming season. Dr. Cohen, based on what we know about flu, COVID-19, RSV, and pneumococcal disease during the last season, what should we expect for the upcoming 24-25 season?
Well, thanks for the, oh, do you want me to come up to the podium for that one? Okay, sure. Terrific. So based on what we know right now, we're expecting a pretty typical flu, COVID, RSV season. What does that mean? It'll look similar to last year. And what I would say is that we have the power to shape how this season is going to go. Because if last season is any prediction of this season, that means 800,000 hospitalizations of flu, COVID, and RSV. And again, we know that these vaccines can cut the risk of hospitalization in half. So we can make sure that we are protecting ourselves and our families from the worst of what these viruses can bring. And we see that it can bring up to 800,000 hospitalizations. Our data, and we can go through more of it, we know that flu vaccines alone helped avoid at least 7.5 million cases of flu. So these are vaccines that can allow us to risk less of the severe illnesses and do more of the things we enjoy. We want to be having those fun Thanksgiving holidays, those Christmas holidays together as a family. We don't want to see anyone ill. And this is particularly important for those who are over 65. We know those who are over 65 are the most impacted by these viruses. And so getting your flu vaccine, your COVID vaccine, and RSV, particularly if you're over 75 for RSV, is incredibly important. And now you're going to hear a lot of numbers and data, and those are very important to tell you about why these vaccines work, to make sure that you are risking less severe disease. But let me talk to you as a mom, a wife, and a daughter. I wouldn't recommend something for the American people that I wouldn't recommend for my own family. You're going to see me get my flu vaccine today, and my daughters who are 10 and 12. We have an appointment for them to get their flu vaccines. They're going to get their updated COVID vaccine. I'm getting my updated COVID shot next day. I could have gotten both today. I'm just choosing to get them on different days, whatever works best for you. My husband's getting vaccinated, but I want to also remind that my parents, who are both over 70, I want to make sure we're celebrating the holidays together. They are both getting their vaccines. Again, I wouldn't recommend something for the American people that I wouldn't do for myself and for those that I love. So I hope as we head into the season, which again, we predict to be similar to last year, we know the power is in our hands. And so we want to make sure we're doing everything we can to get folks vaccinated. And I appreciate the folks and experts who are up here today who are doing all they can. If you are a doctor, a nurse, a pharmacist, a pharmacy tech, the power is in all of our hands. This is a team effort to get everyone vaccinated. Please visit vaccines.gov or cdc.gov to learn more about where you can get information. Remember, we all want to risk less disease and do more this season. Thanks so much.
Thank you, Dr. Cohen. Dr. Muñoz, can you share some insights on the importance of pediatric and maternal immunization, as well as building vaccine confidence among pregnant women?
Absolutely, my favorite topic. So thank you so much for that. So, you know, as you have heard, the CDC recommends that everyone 6 months of age and older receives these vaccines that we are discussing today. Influenza, COVID, and now we have an option for respiratory syncytial virus. Why is that particularly important for pregnant women and children? Well, you know, these are special populations in many ways. Pregnant women tend to have complications from these diseases, especially influenza and COVID, that affect their health in particular, especially in the third trimester of gestation. So for years, we have been recommending that influenza vaccine is given for anyone who will be pregnant or delivering during the flu season. And now we have COVID in addition to that. We also have learned that if you vaccinate a pregnant person, their infants will benefit from that protection as well. And this is particularly important because we don't have a vaccine for babies in the first 6 months of life. We start vaccinating in this country at 6 months for influenza and for COVID, and we have safe and effective vaccines that unfortunately are not as utilized as we wish they would for these populations. We understand that there's high morbidity and potentially mortality in the very young infants. And as a matter of fact, for the last few years, babies in the first year of life are the ones who have the highest risk of being in the hospital, having complications, and also dying from these diseases, influenza and COVID-19. So the only way we can protect those babies in the first 6 months is through that maternal antibody that comes from maternal vaccine. And, you know, it's a mother's gift. This is the way that we are able to survive a lot of problems in early life. I mentioned how we don't utilize it as much. Unfortunately, after COVID, especially the coverage dropped a little bit for our maternal vaccines. Influenza vaccine, about half of women receive it. There's another one, pertussis vaccine that we give that is also important. About 55% of women receive it. But for COVID, it's even much lower. And so I think that at this point, what I can tell you is also a lot of data showing that the most important aspect or the most important reason a woman will receive a vaccine is when a provider recommends it, right? And so she will do anything she can for her baby. I've had my own children, and I know as a pregnant person, you know, you will do everything, your diet, your exercise, and your health is going to be important. So yes, they worry about safety. And the good thing, again, is we have a lot of data on these vaccines regarding how safe they are, both for the pregnant mother and for her baby as well. And I think that if we can work a little bit more, as I mentioned, as providers to let them know about the benefits, it would be hopefully something that will help increase the coverage and protect these babies. I'm very always sad to hear about deaths in influenza, which is vaccine preventable, especially in children. Last year, 2023 to 24 season, there were about 200 children that died from influenza. The majority of them unvaccinated. That has been the same year after year. And one infant or one childhood death from influenza is one too many, because we can't prevent all of these diseases. I also want to share briefly about RSV, respiratory syncytial virus, because this is relatively new to us, but it is also a disease of high importance for children. Babies in the first 3 to 6 months of life have RSV, can present as mostly bronchiolitis or pneumonia. And this is a really important cause of hospitalization and also death, not just here, but throughout the world. So we're very excited to have the option of preventing this disease. And one of the opportunities is through maternal vaccine. Maternal vaccine works in the same way. It's recommended between 32 and 36 weeks for women, mainly to protect the baby. In this case, it's all about the baby. And it works beautifully. You know, high efficacy, more than 80% in the first 3 months, and then very safe as well. So we are entering a second season. There's already data from last year. About 18% of moms received this vaccine, although it was a late start. And we are, again, encouraging everyone, as of September 1st this year, we can start using the maternal vaccine, because we're about to start our RSV season. And sometime in October to the end of the year, we're going to have a lot of RSV. I'll share briefly that we also have, obviously, another option, which is immunizing the baby through monoclonal antibodies. And I've seen data from other countries that are doing all this, and they're really, really having a tremendous impact in reducing RSV. So when we reduce respiratory infections from viruses in children, we also prevent them from getting secondary infections. We've heard about pneumococcus. We also have vaccines for that, you know, but these babies are going to have really a very important head start and protection from their vaccines and also from their mothers. So I would like to, you know, make sure that this is important. I speak for these groups. I say they're special populations. And also I'll say briefly, because I am one of them, minorities, Hispanic populations tend to be affected more, and it'll be important to increase their confidence. And so it's our job. How do we do that? Increasing confidence, taking our own vaccines, making sure our staff, everybody is convinced, and that we talk about this openly to answer the questions that you know, moms, parents might have, and be able to offer them the opportunity not just to know about it, but to actually receive their vaccines. Thank you so much.
Thank you, Dr. Muñoz. Next, Dr. Tuckson. Tell us more about the impact of respiratory diseases on communities of color and why it's important to build greater vaccine confidence in this population.
Well, thank you very much, and thanks to NFID for hosting this very important event. One of the unfortunate characteristics of our nation's health portfolio is the persistent burden of preventable chronic illness experienced by people of color and people who live in poor communities. Respiratory diseases like flu and COVID-19 are a component of this disproportionate burden of illness that leads to hospitalization and too often to death. And as we saw with the recent COVID pandemic, the combination of respiratory illness burden and chronic disease that is pre-existing is a very lethal cocktail. To give you a sense of the magnitude of this challenge, the CDC indicates that from 2009 to 2022, flu hospitalizations were nearly 80% higher among Black adults and 20% higher among Hispanic adults when we compare them to the white community. Looking at our recent experience with COVID, according again to the CDC data, Black, Hispanic, American Indian, and Alaskan Native populations experienced not only higher rates of cases, but also deaths. I think we have to keep reminding ourselves of the consequences of failure. It is not just being sick, it's not being inconvenienced, it is also death. Early data for the Black community in the pandemic showed an almost twofold higher mortality rate than for white Americans. Hispanic and American Indian and Alaska Native populations almost 1.5 times greater risk of COVID-19 infection compared to white populations, and were about twice as likely to die. Unfortunately, for a number of well-understood reasons, despite the magnitude of these challenges, Since 2010, our communities have experienced lower flu vaccination rates when compared to white adults. The need is greater, but unfortunately, the vaccination rates are lower. According to recent data, only 42% of Black adults and 35% of Hispanic adults received a flu vaccine, compared to about 50% for white America. Looking at COVID, in the early stages of the COVID vaccine availability, Black and Hispanic communities, for a number of reasons, experienced much lower vaccination rates as compared to their white counterparts. But here is the key observation. After a concerted, vigorous, and leveraged action by Black America and others of goodwill, such as our colleagues here from the CDC, for the first time in history, we actually closed a disparities gap. It is unbelievable when you think about all that we were up against. We actually closed a disparities gap as represented by primary series vaccinations. So what obstacles did we overcome? Well, it's been well understood that longstanding social inequities contribute to health disparities, and they pose challenges to optimal vaccine coverage. Things like healthcare access challenges, lack of insurance, inadequate transportation and childcare support, the inability to take time off from work, a debilitating level of hard-earned historical mistrust of the healthcare system, relative science illiteracy resulting from suboptimal science education in our schools, and a lack of vaccine awareness and confidence in their safety and efficacy. The good news, as demonstrated by closing the gap in primary series vaccination and by surveys by NFID that indicate that Black and Hispanic people are much more likely to be wearing masks when properly advised than the rest of the community. We've learned that these things show us that when we are given the necessary support externally, and when we mobilize all of our assets within our communities, that we can demonstrate extraordinary progress despite the obstacles and challenges. Let me give you one last little tidbit. Most people don't know this, but by the second year of the pandemic, Black life expectancy was better than white America. Do you understand what I'm saying? That when we were able to close those disparities gaps, at the end of the day, and seeing compliance with mask recommendations and others, actually the Black community did better than white America. This has never happened before, and now we understand that we have a blueprint. So as I conclude, let me just remind you, we've got to keep working on this issue of vaccine confidence. We've got to have proactive and sustained community-level engagement. We can't keep having the Black community, the Hispanic community, and other communities of color starting from a standing start every doggone time. We've got to invest in these communities so there's a consistent infrastructure so we can continue to move forward. We will have to really work hard to overcome this pervasive, targeted, and malicious misinformation that is causing so much disease, illness, and again, death in our community. So with the support of the NFID, the CDC, and many others, we are urging everyone to get their vaccination. We're going to continue to emphasize how important these are, how safe they are, but at the end of the day, the thing that we're actually going to make sure that everybody understands is that when we as a community of people decide to take our own lives in our hands and we get the support necessary, we can do it.
Thank you, Dr. Tuckson. Next, Dr. Daskalakis, can you share insights on the importance of protecting older adults and those with chronic health conditions from respiratory diseases? Based on trends in coverage in recent years, are there other groups whom you're most concerned about low immunization rates?
I'll start by making the official request that I don't go after Dr. Tuckson. So thank you for those questions. So first, to reinforce, everyone who is over 6 months of age should get a COVID shot and a flu shot. And if you're over 75, slam dunk, you should also get a RSV shot. So we'll start with that. But important to say that there are individuals who are older, who are over 65, and those with underlying conditions like asthma, diabetes, and heart disease, who should especially make sure that they're up to date because of their risk for some of the more severe complications. I'm gonna just focus a little bit on folks who are over 65, just to give you some stats that may help you in terms of your decision-making or decision-making with your patient. So in recent years, between 70 and 85% of seasonal flu-related deaths in the United States have occurred in people over 65. Those are preventable with vaccine. Compared to people who are 18 to 39, folks who are over 75 are about 9 times as likely to die from COVID. Those are also preventable. Over 95% of adults who were hospitalized last year due to COVID-19, that's 95%, did not have an updated COVID vaccine, reinforcing the importance of that updated COVID vaccine in preventing some of the worst outcomes. And we know that people lose some of their quality of life if they get hospitalized, and up to 160,000 older adults get hospitalized for RSV every year, and that actually translates into 6,000 to 10,000 deaths per year for RSV in folks who are over 65. So, really important that folks who are over 65 really make sure that they're up to date. It means, like Dr. Cohen said, more time for Thanksgiving, more time for the other holidays, more time to see their kids and their grandkids and their other loved ones. And also, no one wants to go to the doctor or be at the hospital. And even though these may not prevent disease, better to have a sniffle than to be in the intensive care unit. So really important for those people to make sure that they are up to date. Now, older adults tend to be pretty great at getting vaccine, but we're losing some ground. So almost 70% of adults over 65 actually had their influenza shot. Now, when you look at COVID, it's about 40%. Now, they tend to be the precocious students. They're way ahead of some of the younger folks, but we can do better because of the numbers that I just told you. Imagine if that coverage increased, what we could do in terms of impacting the health of older adults. Now, with that said, too, individuals with underlying conditions are also folks that we need to sort of have special attention to. Again, remembering, I told you, over 6 months, get the shots for COVID and flu. Over 75, slam dunk, get the RSV shot. But if you have underlying medical conditions, I put you on that list as well. The way that I sort of work with my patients, make sure that you're up to date. Important stat, just about 40% of people with an underlying condition in that 18 to 49 range actually got their flu shot. So that's exactly the group of people who are at risk for some of the worst complications beyond age. So reminding them it's important to stay up to date is also really important. Generally speaking, folks who are at higher risk for the worst complications of these viruses, it can be older, they can be younger, they can be people who have compromised or weakened immune systems, people with disabilities, and pregnant people. And as you heard, there's an impact for influenza, flu, and RSV, influenza, COVID-19, and RSV in giving those vaccines to pregnant people, not only for protecting the pregnant person, but also for protect mom and protect the baby. Really important. Now, the second part of the question is, are we concerned about other groups? And CDC's job is to be concerned about everyone, but I want to highlight some very specific folks that we really want to emphasize the importance of vaccination. I will not be able to say it as well as Dr. Tuckson, but I think definitely seeing, and also Dr. Muñoz, what we're seeing among sort of individuals who are in some racial or ethnic groups, we're seeing worse outcomes, but we're also seeing, in some cases, lower coverage. So really important to really focus on making sure that we make our stride to make everyone healthy, really include an eye toward how we can make sure that those folks who are overrepresented in so many diseases are given the access to vaccine to be able to protect themselves and their families. I also want to highlight another geographical consideration, which is folks who live in rural areas. So we definitely see in children that there is a decrease of about 20% between coverage for flu in rural areas versus urban. And that's something that we can do better on. And I think thinking about our pharmacy partners, thank you for being here, so important because it really extends our access for these vaccines to people who may be able to go to a pharmacy but may not always be able to get to a clinician's office. And then last but not least, pregnant women, Again, for flu and COVID, it is a 2-for-1. You protect mom and you protect the baby. Again, I love that it's the gift, mother's gift. So that mother's gift of that borrowed immune system for the first 6 months is really important. Just to remind you, 95% of infants under 6 months of age who were admitted to the hospital for COVID-19, their mom did not have a COVID-19 shot. That is preventable. And again, the gift of mom is really important there. And then same with flu, we're losing ground. So compared to before the pandemic, we are about 10% less in terms of flu coverage for pregnant people. And that translates into more babies being admitted to the hospital and more moms getting sick from flu and potentially compromising their health as well as the health of their baby. So I think that answers the question. Thank you so much for the opportunity and looking forward to ongoing discussion. Thank you.
Thank you, Dr. Daskalakis. Before we open it up to questions from the media, I'd like to invite Christina Diodu from Walmart to join us on stage to vaccinate Dr. Cohen against influenza or flu. After the news conference concludes, we'll invite all panelists, partners, and members of the media to join us for a flu vaccine clinic. NFID is committed to collaborating with partners to advocate with one strong voice for disease prevention. Please show your support by joining the NFID Leading by Example initiative and share your vaccination photos on social media using the hashtag #GetVaccinated, and be sure to tag NFID. We'll come back shortly for our questions.
There we go.
Brings back those mass vaccination efforts during the pandemic.
I didn't even feel it. Yes. She's amazing.
Christina's a star.
So, I mean,
Indeed.
seriously, well done.
Thank you.
All right.
Thank you very much, Christina. Dr. Cohen, thank you for joining us. I know you've got to sneak off to another event, and we appreciate your participation in our press conference today. I'd now like to open up the Q&A to our media. Please note that this portion of the event is reserved for questions from credentialed media only about flu, COVID, RSV, and pneumococcal disease. Please raise your hand to indicate you have a question, and one of our staff will bring you a microphone. For media participating online, you could submit your questions directly to the webcast. To all our media representatives participating, please identify yourself and your media outlet you represent before asking your questions. We have a question here in the room.
Hi, Dr. Cohen. This is Fennett with the Washington Post. So you just led by example here. Should the president and vice president also be leading by example and talking about their vaccines? Because we haven't heard anything from them this month. And before, they would encourage people to get vaccinated, but they've been silent this go around.
Well, first, I want to lead by example. It's why I got vaccinated today with my flu shot. I want to encourage folks that you can get your flu and COVID on the same day. I happen to be getting my COVID shot next week, but feel free to get both in the same day. And I think we all, as leaders, want to lead by example, and that includes all elected officials. And I know I want to make sure the president and the vice president are well protected as we go into the season. So I look forward to them getting their vaccines as well.
Conversations with them about messaging around vaccines and using their bully pulpit?
Well, we've definitely talked about how we all as a team can be sure to be sharing these important messages. Is why we're here today with both experts, but talking about your own personal experience, I think, is really powerful. I think folks want to hear the data and the numbers, but then talking about your own personal experience, I think, is really helpful. So when you get your vaccine, do what I did and then put it on social media and encourage other people to do it. So a charge for all of us to do that, of elected officials, I think, on both sides of the aisle. This isn't about politics. This is about just making sure we're getting into the season and being as protected as we possibly can. We know these vaccines reduce your risk of going to the hospital by half. And remember, for those of you who know about long COVID, no one wants to be sick, particularly not with long COVID. And long COVID can come just from even a mild case. That is my husband's number one reason for him getting vaccinated. We unfortunately have a couple of friends in our friend network who have had long COVID. Don't go there. The best way is prevention with these vaccines.
To me from the survey that 31% of medical professionals got the 23-24 vaccine. So if medical professionals aren't clamoring to get updated COVID vaccines, why should the rest of Americans?
Well, that's what we're encouraging folks today, right, is to make sure that we are leading by example, to make sure that our doctors, nurses, pharmacists, nurse practitioners, PAs, who did I miss? Everyone is getting involved in team health here. It is a team sport. We need everyone's help. I was grateful for our pharmacist from Walmart who just gave me my vaccine today. But it is very important for us to lead by example, but also to make sure that they know that their voice is so powerful. Actually, our data at CDC shows that one of the number one reasons folks don't get vaccinated is that their doctor or their nurse practitioner didn't bring it up. And so they just make an assumption that it's not for them or it's not recommended. And so it's so powerful for our folks who are coming into the office to get that recommendation, even if they're coming in for a different reason. And we've been working really hard on that process, from the moment you check in to the time that you get your vitals checked to the actual appointment to check out, opportunities to have that conversation. I'm grateful for our partners at places like Epic, the electronic health records that helps give us prompts as doctors and nurse practitioners to say, hey, time to ask about flu shot and COVID vaccine, RSV if appropriate. So again, it's a team effort, and we need to think about all the ways in which we can help folks get vaccinated.
From CBS. Couple questions. First of all, since we saw this COVID surge this summer, what are we expecting for caseload in the fall? I know that you said we're expecting a typical year, but COVID specifically, given this summer surge.
Sure. I'll start, and then I'll turn it over to Dr. Daskalakis. But we are, right now we saw an increase in cases, or I should say viral transmission of COVID over the summer, similar to what we saw last summer. But what we're seeing now is per case that we're seeing is less hospitalizations and less death, which is good. It tells us that we have underlying immunity. It's not that this virus isn't changing, because it is, and is actually changing faster than flu. But it does tell us we have some underlying immunity that is decreasing the amount of hospitalizations and death. But if you ask me to stack rank COVID next to flu, COVID is still causing more hospitalizations and death than flu. And so if you're someone who has regularly gotten their flu shot, you want to add COVID to that, because COVID is still causing more hospitalization and death, even though it's lower. So we're seeing summer waves, and it's telling us that COVID is not confined to the winter like flu and RSV are. It can be a year-round disease. Even more important for us to stay updated on our vaccine, and doing it now ahead of the winter, when we do expect more hospitalizations and more death from both COVID and flu. Now is the right time to get vaccinated. Anything you want to add, Doctor?
I really couldn't add to that. That's great. Thank you.
Sorry, I didn't.
That's perfect.
What can you tell us about the matches this year?
That I'll let him do.
Got it. So in terms of just generally, when you think of a vaccine, though we use the word match often, it's really about sort of the depth and breadth of the immune response that the vaccine generates. And so the selection in COVID of a JN1 lineage, antigen in the vaccine really looks forward into what could happen with variants, but also looks back in terms of our immune history. So I think given what's circulating, even some of the new variants that are Twitter stars, though not stars in our nowcast yet, I think we are forecasting that the current COVID vaccine will be really good in terms of depth and breadth at preventing some of the worst complications of COVID. Flu, same. I think that, again, every year, one of the important things that we do is monitor what's circulating, and based on what we're seeing today and what we're seeing in other parts of the world, we think that that the flu vaccine will also provide the depth and breadth to protect the population. Thank you.
And then one more on RSV, if I may.
Sure.
Last year we saw shortages with the RSV vaccine in particular. What's being done this year to make sure that doesn't happen?
Thanks. We worked very hard with manufacturers to make sure that we weren't in that same place going into this year, and the good news is we're not. So we see a very ample supply of the monoclonal vaccine for infants. So again, recommending starting right now for our babies under 8 months to get that RSV immunization.
And just to also note, there is the vaccines, so the two vaccine products that are indicated for pregnant women, as well as for older adults. Those from the supply perspective look, again, like last year, great. Just want to also thank, I actually see our partners that we worked with so much over the year on this. I want to thank the partners and also want to shout out the FDA for their amazing work. So I think a lot of great interaction to sort of make sure that we are in a much stronger position this year than last.
So we have a question from one of our online participants, Alexander 10 from CBS Digital. CDC used to recommend flu shots in October as the best time to get vaccinated. Has that changed? And what has CDC done to study why flu uptake, vaccination uptake has decreased over the last year or two?
I'll start and then over to Dr. Daskalakis. But right now is the best time to get your updated flu shot, your updated COVID shot. We are here at the end of September, but through October. But it's also not too late. Say you miss the October window, get it in November. The important part is getting these vaccines. They're the single most effective thing you can do to protect yourself and your family, your community.
And could you repeat the second part of the question?
Second part was, what is CDC doing to study why flu vaccine uptake has declined?
Great. So I think lots of work in lots of spaces, and one of them, I'll start with the sort of most common thing that we do is a lot of engagement. So making sure that we talk to organizations and populations that we serve to really understand better how we can provide the information that they need so they can make informed decisions about their health. I think the other part is that we have a lot of different survey tools, and I think that we do get a lot of different sort of answers as to why people are less frequently getting the flu vaccine. One that sticks out to me is convenience. And so I think that, that there's a lot of sort of conversation about how effective it is, what are the side effects. So those are also players, but one of the big ones is it's just not convenient. And so I think we're here to make the point that there's a lot of places where you can get a flu vaccine and a COVID vaccine, including your clinician's office, including pharmacies. And so if we can sort of expand people's vision that, like, if they're able to go to the grocery store with the pharmacy or the pharmacy to pick up their toothpaste, that there's an opportunity to get vaccinated. I think that since COVID, so many opportunities have emerged to address some of those issues. And from the perspective of side effects and effectiveness, that's why we're here today, to sort of magnify sort of that message. We talk a lot about these vaccines and sort of the burden of what the diseases do, but we need to also highlight what happens when you get them. And so, for example, for flu, even with imperfect levels of coverage in the population, almost 7,000 deaths were prevented. Imagine if we doubled or tripled our coverage, how many deaths we would prevent. Same with COVID, same for RSV.
And just a question that was asked earlier, and I think we've already mentioned it a couple of times, but Dr. Cohen, comment again about getting your flu vaccine at the same time as other vaccines.
Great. Okay to get your flu shot and your COVID shot on the same day. I would recommend in different arms, but okay to get it on the same day for convenience. One and done, one appointment, and then you're all set. also okay to separate them. I happen to be separating them just so I get another opportunity to share this message, but very much okay to get your COVID shot and your flu shot on the same day. The most common thing we hear about is maybe some pain at the injection site, but I will tell you, I don't have pain right now. But also some fatigue, again, just thinking about staying hydrated, taking some Tylenol or some ibuprofen after getting your vaccines, but absolutely okay to get both on the same day.
We have a question here from Jacqueline Roman from NewJersey.com and the Star-Ledger. This is for Reed Tuckson. What are some of the reasons for declining vaccine confidence among U.S. adults?
The challenge is that two things are particularly key. One is the really pervasive issue of misinformation and disinformation. We are flooded and bombarded on social media and other forms of public conversation with just plain old facts that are wrong. They're not facts, they're misrepresentations. We also have a number of people who are distrustful of our healthcare enterprise. We know that American healthcare has room for improvement in making sure that every encounter that we have with every person, whether it is a clinical encounter or a public health encounter or someone enrolling for a clinical trial, whatever that touch point is, we've got to make sure that our people in this country understand that they can trust and rely on the integrity and the expertise. Finally, we have a real issue of the benefits and the beauty of American technological innovation are extraordinary. The idea that you can have an mRNA vaccine that could be developed the way that it was developed and have it be so safe and effective is extraordinary. Unfortunately, too few Americans understand what mRNA even is. We're going to have to double down on how we support and fund our secondary science school education programs so that our population can have the level of literacy required to be a modern adult in this wonderfully technologically and innovative world. Put all of those together and we really have a crisis. But the good news is, as we are experiencing, it is possible to have that conversation. That's why organizations like the Coalition for Trust in Health and Science have been done. The entire health ecosystem saying to the American people, we get it, we understand how important this is, and we pledge ourselves to do everything in our power to regain and enhance that trust, and also to make sure that you have the evidence and know how to use the evidence as you make personally appropriate choices about your health, your family, and the community in which you live.
Thank you very much, Dr. Tuckson. I have a question from Fen Huang from NPR for CDC. What streams of data will be collected for cases, outcomes, and vaccination this winter virus season? And when and how can the public access that information?
So a one-stop shop for looking at our data is our new respiratory virus channel on cdc.gov. It really starts at a sort of surface level, giving us an overview of the respiratory season. And you can really pick narratives and stories with data stories within there to go deeper. And that will include a view into what's happening with vaccination. In fact, today, we'll be posting our first national immunization survey data that will give you the very earliest view in terms of what's happening with flu, COVID, and RSV vaccination. Additionally, we will continue to publish data around our emergency department visits. This is one to watch the space. We have some very exciting innovations coming in terms of how we're sharing about the respiratory season. And so really watch that respiratory virus channel for some really new and exciting changes. Additionally, we'll continue to report on hospitalizations and we'll continue to publish our forecasts. That both includes a forecast for the season, which I think Dr. Cohen really summarized very well, but then also an estimate of where we are in terms of progress for COVID during the COVID season, publishing a view into what our near future will be based on what we're seeing today. So a lot of news, lots of information. One-stop shop is that respiratory virus data channel.
All right, we have a question from online from Sabrina Cupid from WSB Radio Atlanta. Are there people who should avoid getting COVID and flu vaccine on the same day? For the first question, Demetre.
I mean, really, there's no contraindication. There's no reason not to get the COVID and flu shots on the same day. It is, of course, a personal decision, and I'm going to just highlight what Dr. Cohen said. If you don't want to do it on the same day, another important thing to remember is that there's no minimal time between the shots. So if you decide I'm going to get my flu shot on Tuesday, you can totally go in on Wednesday to get your COVID shot. No big deal. So it can be on the same day. It can be spaced close together. But there's not one sort of human or type of human that I would say isn't able to get those shots on the same day. Obviously, talk to your clinician, talk to your pharmacist. If you've had like a bad reaction when you've had both shots, you may want to not consider taking it on the same day, but that is really about not a very common event. So again, always ask your clinician, ask your pharmacist, ask others who are taking care of you to make sure that it makes sense for you. But co-administration is a really good idea.
And a follow-up from Ms. Cupid for Dr. Muñoz, is it safe for pregnant women to get co-administration of vaccines?
Absolutely. So again, opportunity is quite important. During antenatal care, there are many opportunities to get vaccines. We have several vaccines recommended for pregnancy, again, for moms or for the babies or for both. And I think in this aspect, it's super important to plan ahead and to work with your obstetrician, your antenatal care provider. By the way, a lot of support from ACOG and from the obstetrician community in this country for maternal vaccination. But with their advice and blessing, the recommendation is that all these vaccines recommended in pregnancy can be given at the same time, and make sure that you don't miss a chance to receive the vaccine. If you don't want to get them at the same time, that's also an option, because some are seasonal, some are not. Some can be given at any time in pregnancy, and some have a small window of time when you need to give them. So that's why planning is important. Thank you.
So this question I'm going to pose to both Dr. Tuckson and Dr. Muñoz, and certainly Dr. Daskalakis may want to add some comments also. Beyond vaccination, what other prevention strategies are important for us to think about during this respiratory season? Is hand washing important? Are masks important? What other things do we need to be talking about? Vaccination is still critically important, but what other things do we need to be doing also?
The most important thing, I think, is common sense. And secondly, followed close behind that is a sense that to care about whether or not what you may do could sicken or injure another person. There's a moral and ethical issue here. Some of us want to be heroes and sheroes. I was sick as a dog and I went to work anyway, and that shows you how tough I am, as opposed to the other narrative is, let me tell you how rude I am and how willing I am to infect other people just to show you what a great ego I am. Which side of that equation do you want to be on? As regarding masks and so forth, for hand washing, first of all, we were all taught 100,000 times. We learned it in kindergarten. It doesn't change. You wash your hands. That's just common sense. As far as masks is concerned, I really think that what the big challenge that we are now facing in America with these kinds of illnesses is how do we deal with risk calculations and uncertainty. We don't always know whether I should wear a mask today or not. Is this the day I should have it on? Am I going to be around someone who is immunocompromised? Am I going to go be visiting in my case, my 99-year-old mother? Am I willing to get off the airplane and go rushing right into her loving arms without a mask on? These are risk calculations that we just have to make as individuals. And so no one can always give you those calculations. Let me remind everyone very quickly, though, as I bring this answer to a close, let me remind you that nonsense that we saw, this misinformation around whether masks work or not, masks work in terms of not being able to spread a disease from one human being to another or not having it come back and forth. So whether you choose to wear it or not, please wear it or not based on the evidence that they are effective. But at the end of the day is, how often do you have to do that? Use common sense, guided by a sense of ethical and morality.
And the mask covering both the nose and the mouth.
Well, let me quickly say that someone whispered in my ear that you have to, if you're going to, that's one of the challenges with all the studies around masks, is that people don't wear them properly. So you do have to wear it so that it covers your mouth and your nose, and wear it properly if you're going to do it.
All right, I have two. One, breastfeeding. Keeping on with the theme of moms and babies. You know, that's an additional benefit of moms receiving their vaccines, that you do have the antibody coming through the placenta, but we also know from a lot of previous studies, from natural disease, infections in pregnancy, or from vaccination, that antibodies can go through the breast milk, and that babies who are nursed, especially during the winter time, are going to have a lower risk of having respiratory infections. It also works for diarrhea, so diarrheal illnesses, are going to be prevented. But if there is any concern about the timing of the vaccination or how long the protection lasts, I think that there's also, especially for influenza, in countries where there's year-round circulation of influenza, that women who nurse their babies even can get protection for the entire first year of life for these babies. So breastfeeding is something that I would highly encourage moms to do, especially during the winter season. And the second one is inform yourself. I think that as Dr. Tuckson has said, misinformation is a problem, but I think that we do need to have ownership in our decision-making, especially as parents, and parents need to have the opportunity to inform themselves and ask questions. And so I would highly encourage that they talk to trusted healthcare providers, that they go into trusted sites. I mentioned ACOG, Obstetric Gynecology, AAP, American Academy of Pediatrics, NFID. All of these sites have information that is available to you. Obviously, CDC has even more tools for providers to give information about why we are doing what we're doing. And again, I think that if you have that knowledge, you will be able to make informed decisions for your family. It's not about just one person. It's a family unit that I would encourage for people to care about. Yeah.
Great, thank you. We have another question online from Fen Huang from NPR in the misinformation vein. Florida's health department issued guidance that seems to discourage residents from getting vaccines this winter, raising safety and efficacy concerns. Are those concerns valid, Dr. Daskalakis?
So I think the story of vaccine is really important to sort of be very transparent about. The benefit of a vaccine is far greater than its risk. And we know that vaccines prevent really severe complications of some of the respiratory viruses that we're talking about today. So ultimately, given what our data shows, I think our pretty clear guidance that to prevent these infections, first on the list is vaccination. And again, I think we've heard about a lot of other strategies, including hygiene, ventilation, treatment, which is also really important for folks who are at risk, and the if you're sick, stay home strategy, which I think we've heard about a lot, as well as additional ways to prevent, like masks, distance, and also adding testing in the mix. So at the end of the day, vaccines provide a strategy that allow you to risk less and do more, which is really what we discuss in this season and seasons going forward, that it is a strategy that is never without risk. There is, people do have side effects from vaccines. They tend to be very, very minor, and they tend to be something that's very time limited. What I can tell you is the vaccine has prevented thousands of deaths, hundreds of thousands of hospitalizations, and many people's need to go visit the hospital. So again, really important tools in the toolkit to make sure, and I'll say it again, that folks risk less so that they can do more during the season.
I just have to say that I don't have to be as politically nuanced. What this person does with this misinformation and mischaracterization makes it so much harder for the rest of us who are trying to fight for life. Listen, I've been at this for more than 40 years, fighting for the health of not only all Americans, but particularly for people of color. And we have to double fight all this stuff that comes out of Florida. It makes it harder. It means a drain on resources, a drain on time. You have to double what you've already done. And I just am, quite frankly, infuriated that we would have to have yet another element that makes the fight for human life so much more difficult. And so I would have to say that some of us take this these challenges that come out of Florida very, very personally, because there's too much on the line for playing politics with human survival.
Thank you both. And our last question from Hannah Webster from the Pittsburgh Post-Gazette. If someone recently had COVID, what's the protocol for them to get vaccinated, and has our knowledge of length of immunity shifted over time? Dr. Daskalakis, I'll let you start, and then I'll follow up.
Great. Perfect. So I think we recommend that people think that, about potentially waiting 2 to 3 months after having a COVID infection before getting their COVID shot. With that said, that's not an absolute recommendation. People are able to actually make the choice that they want their COVID shot before. I'll give you a great example. One of my colleagues said, I'm going to be traveling and I want to make sure I'm protected from COVID. It's only been a month and a half since I've gotten sick. What should I do? So you could wait longer, or you could get the shot. It's safe. It's something that you can do. And again, though there is like a little bit of a guidance around what to do in terms of timing, it really is something that you can discuss with your doctor, discuss with your medical provider, discuss with your pharmacist to see what makes sense. But ultimately, I think it's okay to get it a little bit earlier, but you could wait up to 3 months.
I had that exact same conversation with one of my colleagues in a different field of medicine in the parking lot, headed to the airport to fly here to DC. You know, you really have to think about, again, what Dr. Tuckson said earlier. What is your risk? What situations are you going into? And where are you going to get the greatest benefit going forward? And so we need to have those conversations. And again, thoughtful conversations between healthcare professionals and patients are the key to us providing safe and effective care for our society. So I want to thank all of you today. It's time for us to bring things to a bit of a close. Our panelists have each emphasized how important it is to get vaccinated, and Dr. Cohen has modeled just how easy it is. As I mentioned earlier, we encourage you all to show your support for vaccination by joining the NFID Leading by Example initiative. Share your vaccination photos on social media and using the hashtags Get Vaccinated, Fight Flu, Prevent Pneumo, Prevent RSV, Stop the Spread, and be sure to tag NFID. And remember to take 3 steps to protect yourself, your loved ones, and your communities from illness this fall and winter. 1, get vaccinated. 2, practice healthy habits. Stay home when you're sick. Cover your coughs and sneezes. Wash your hands often, and consider wearing a mask if you or a household member at increased risk for severe illness. My daughter will probably club me when I get home, but use that sleeve for those coughs and sneezes and not your hands. Treat with prescription medication if recommended by healthcare professionals. This news conference is sponsored by NFID in collaboration with CDC, with support from professional societies and patient advocacy partners, in-kind support from Walmart and Sanofi Vaccines, and unrestricted educational grants from GSK, Merck & Company, Moderna, Sanofi, and Securus. Note that NFID policies prohibit funders from controlling program content. I want to thank the panelists, our partners, and the media for participating. I want to thank you all for all you do to help raise awareness and educating the public about the importance of disease prevention. Your partnership is essential in protecting public health. A video of today's news conference and additional resources will be available on the NFID website at nfid.org/2024 flu news. This concludes the formal portion of our press conference. The members of our panel will now stay up on stage and we will get our flu vaccines. And so thank you all for being here with us. Yes, they're going to come up to us.